So today we will be talking about an important topic, especially for the for USMLE perspective. They usually ask questions from this, and this is the hidradenitis suppurativa. So what it is that it is a chronic inflammatory skin condition in which there is formation of abscesses and sinus tracts, usually in areas of the skin, in areas of the body where there is skin to skin contact, like the armpits, like the gluteal regions, like the groin. So those regions are basically affected. So let's just go step by step. Let's first talk about the risk factors. Risk factors are often really important for hidradenitis suppurativa. They often ask questions like the patient may be smoking or is obese, and they will tell you like which one are you going to recommend to the patient. So if the patient is a smoker, just say smoking cessation. If the patient is obese, just say there should be some strategies to for the patient to lose weight. So that's obesity. So smoking, obesity, and then others like diabetes, the metabolic syndrome. Those are important risk factors. Other risk factors include female gender and African Americans. So those are other important factors. Now let's go down to the pathogenesis and just to know how the hidradenitis suppurativa actually occurs. And so first, the thing that is involved, the pathogenesis of hidradenitis suppurativa, is basically the pilosebaceous unit or follicular pilosebaceous unit. So what is that? So follicle is just this area, this thing from where the hair kind of originates. This area. This is called the this is called the follicle, and then the pilosebaceous is basically there's another gland called the sebaceous gland, which produces the oil in the skin. Like if you know that some patients have like too much oil on their faces, so that oil is basically sebum, and which is also secreted here. So this whole unit is called the pilosebaceous unit, and in hidradenitis suppurativa, this pilosebaceous unit is basically dysfunctional. So now what happens first is that there is keratin proliferation. So what happens here in the skin is that the keratin kind of proliferates, and but it's just that the reason for this proliferation is just the risk factors. Just remember, like anyone with these risk factors, like smoking, obesity, diabetes, and female African Americans. So those people are really usually at risk. There is also genetic predisposition. So these are at risk, and there is a keratinous proliferation, and eventually there is a keratin plaque formation. And what happens is that this follicle now is blocked, and once it is blocked, the remaining the area behind that, the follicle kind of dilates. Okay, so all of the junk kind of accumulates here. All the sebum, everything accumulates here, and the follicle dilates. Then the second thing is that it dilates so much that it ruptures. It dilates so much that it basically ruptures the follicle, and so once it ruptures, it actually causes inflammatory reaction. So what happens is the neutrophils come here, the macrophages come here, the lymphocytes come here, and the neutrophils will cause a pus formation, and so all of the neutrophils and everything come here, and there is also involvement of TNF. All the cytokines come here, and the inflammation kind of sets in. And once it ruptures, it can actually then go on here and it can form the sinus tracts. Like here, it can form sinus tracts, and this abscess can then kind of constantly drain for weeks to 2 months. It can drain from the skin surface, and so it can form that. Alternatively, it can actually form a scar as well, like here. So it can form a scar. It can form sinus tracts. So remember, once you see the scars, this kind of sinus tract formation, it means that the disease is basically very advanced. And so now let's come down to the treatment. Like before, initially I told you that usually it occurs in regions where there is skin-to-skin contact, like we can say here in the armpits. So it can occur in the armpits, it can occur in the groin region here, and it can occur in the gluteal region. It can occur here in the breast, under the breast, because there is also skin-to-skin contact there. So it can occur usually at the skin contact regions. So now let's talk about so these were the common locations to be aware of, and this is just so what are the clinical features? So clinical features include, like we talked about, it can be abscess formation, there can be sinus tracts, there can be scars. You can visibly see that. It's really easy to recognize. You can search on Google and you can find a lot of pictures, really gross pictures of this of hidradenitis suppurativa. It's really easy to recognize if they give you a picture. So here you can just see the lumps here. You can see folliculitis going on, maybe microabscess formation, This is just an image from Google. So in order to know the severity, you can do something called the Hurley staging. And Hurley staging just takes into account the number of nodules and abscesses, the sinus tracts and scar presence, and the extent of disease. So stage 1, or you can see just the mild one, the mild hidradenitis suppurativa. You just have like a single or multiple nodules or abscesses. The sinus tract scars are absent, and it's just isolated lesion, just one or multiple isolated lesions. And then in the stage 2, or you can say it's the moderate one, and this one is the mild. In the moderate one, single or multiple nodules or abscesses are present, just like in stage 1. But the sinus tracts and the scars are positive. They are present. And the lesions are widely separated. There are multiple lesions, but they're widely separated. And so, for example, like they can have this is one lesion, and then here is another lesion. Obviously, this patient has a more advanced disease because there are so many lesions and they're close together. But if there was just like these two lesions, for example, this one, and all the others were absent, then we can say it's basically stage 2. And then the severe one, we have multiple nodules and abscesses, and there is scar formation, and there are sinus tract formation, and it will be diffuse involvement. Like in this patient, look, there's diffuse involvement, a lot of the areas involved, and the lesions are also interconnected, like here. So that was basically about the clinical features, and then let's go down to the treatment. So the treatment first, you should look at the lifestyle. So obviously, if the patient is smoking, stop smoking, and if the patient is obese, try to reduce weight, and other things like control diabetes. Also, loose clothing. So loose clothes should be worn. And then the treatment, basically the medical treatment. You should know that there is actually no cure. We can just give supportive treatment just for symptomatic treatment, and so the medication depends on the staging, right? If it is early stage 1 or the mild form, you can just give topical clindamycin, and if it is stage 2 or 3 or a more moderate severe one, you can give systemic antibiotic like or tetracycline or rifampin. And if that doesn't work, then you can actually, in very advanced disease, you can just give biologic agents like anti-TNF, for example, adalimumab. So then another step that you can take is basically also surgery. Like if it is not responsive to any of the above treatments, and if it's a really advanced disease, then you can do just wide resection. But remember, there is no cure. This is all just symptomatic treatment. So because all of these, like the TNF and everything, is involved, right? So this is why the biologic agents are actually effective, but they're given late in the disease. So another thing to be aware of is in hidradenitis suppurativa is that it is associated with high risk for suicide and depression and suicide. So we should be these patients should be screened for depression. So this screen for depression, and there is also increased risk for carcinoma, squamous cell carcinoma of the skin. So they should be screened for that as well. If it is found, it should be treated. If depression is found, it should be treated. So these are extra points that you should be aware of as well. So hope this was clear.